Hi and welcome viewers of Nursing Academy 101. I'd be happy to provide you with some challenging nclex-rn and Prometric style questions related to the community health nursing, along with the answers and rationales. Please note that these questions are meant to be difficult and may require a comprehensive understanding of the topic. But before we start, please do not forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question 1. A community health nurse is assessing a neighborhood for potential health risks. Which of the following findings would be of greatest concern for the nurse? A. A community garden providing fresh produce to local residents. B. An increase in the number of registered nurses working in local clinics. C. A rise in the number of children diagnosed with lead poisoning. D. An increase in community members participating in exercise programs. Answer. C. A rise in the number of children diagnosed with lead poisoning. Rationale. An increase in the number of children diagnosed with lead poisoning is of greatest concern as it indicates potential environmental hazards that could affect the health and well-being of the community. Lead poisoning can have serious and lasting health effects, especially in children. The other options, A, B, and D, reflect positive community health initiatives. Question 2. The community health nurse is planning an educational program on primary prevention of cardiovascular disease. Which of the following interventions should the nurse prioritize? A. Teaching stress management techniques. B. Providing information on advanced cardiac life support, ACLS. C. Distributing brochures about managing hypertension. D. Instructing on the importance of annual flu vaccinations. Answer. A. Teaching stress management techniques. Rationale. Primary prevention aims to prevent the development of a disease before it occurs. Stress management techniques address a risk factor, stress, that contributes to cardiovascular disease. The other options, B, C, and D, focus on secondary prevention, early detection and treatment, or general health promotion. Question 3. The community health nurse is conducting a needs assessment in a low-income neighborhood. Which data source would provide the most comprehensive information about the community's health status? A. Hospital discharge records. B. Census data. C. State Health Department reports. D. Local school attendance records. Answer. A. Hospital discharge records. Rationale. Hospital discharge records provide comprehensive data on the health status of the community, including information about prevalent diseases, treatments, and healthcare utilization. Census data, B, may provide demographic information, but it doesn't capture detailed health data. State Health Department reports, C, and local school attendance records, D, offer specific but limited insights. Question 4. The community health nurse is working with a group of older adults. Which intervention would best promote healthy aging in this population? Answer. A. Organizing a monthly social gathering. Rationale. Social isolation can negatively impact the health of older adults. Organizing social gatherings promotes social interaction and emotional well-being, contributing to healthy aging. While the other options, B, C, and D, are important, they address specific aspects of aging rather than the overall well-being of the population. Question 5. The community health nurse is developing a disaster preparedness plan for a local community. Which action should the nurse prioritize to ensure an effective plan? A. Stockpiling a 30-day supply of essential medications. B. Conducting regular community-wide disaster drills. C. Creating an emergency communication network. D. Providing first aid training to community leaders. Answer. C. Creating an emergency communication network. Rationale. Effective communication is crucial during disasters to coordinate response efforts and share important information. Creating an emergency communication network enhances preparedness and ensures that community members receive timely updates and instructions. While the other options, A, B, and D, are important components of disaster preparedness, communication is the foundation for effective coordination. Question 6. The community health nurse is conducting a home visit for a pregnant teenager. During the visit, the teenager expresses concerns about completing her education while raising a child. Which of the following interventions should the nurse prioritize? A. Providing information about available childcare services. B. Discussing the option of adoption with the teenager. C. Advising the teenager to postpone her education until the child is older. D. Exploring educational opportunities that offer flexible schedules. Answer. D. Exploring educational opportunities that offer flexible schedules. Rationale. Promoting the teenager's education while accommodating her new parenting responsibilities is important. Exploring educational options with flexible schedules allows her to continue her education while caring for her child. The other options, A, B, and C, do not directly address her desire to complete her education. Question 7. The community health nurse is conducting a tuberculosis, TB, screening clinic in a homeless shelter. Which of the following individuals should be prioritized for TB testing? A. A resident with a history of multiple respiratory infections. B. A resident who reports recent weight loss and night sweats. C. A resident who has a positive purified protein derivative, PPD, skin test. D. A resident who arrived at the shelter 3 days ago. Answer. B. A resident who reports recent weight loss and night sweats. Rationale. Weight loss and night sweats are classic symptoms of active TB infection. Prioritizing this resident for TB testing is essential to identify and treat active cases promptly. The other options, A, C, and D, do not present the same level of urgency for testing. Question 8. The community health nurse is planning an influenza vaccination clinic for a senior center. Which approach is most effective in ensuring high vaccine uptake among the older adult population? A. Using social media to promote the clinic to younger family members. B. Offering a choice between the injectable and nasal spray vaccines. C. Providing informational brochures in multiple languages. D. Scheduling the clinic during a regular senior center activity. Answer. D. Scheduling the clinic during a regular senior center activity. Rationale. Scheduling the clinic during a regular senior center activity increases accessibility and convenience, making it more likely for older adults to attend and receive the influenza vaccine. The other options, A, B, and C, may have some impact, but scheduling during a regular activity promotes engagement and participation. Question 9. The community health nurse is working with a community group to address childhood obesity. Which strategy is most effective for promoting behavior change among families in the community? A. Distributing educational pamphlets about healthy eating. B. Hosting a one-time seminar on childhood obesity risks. C. Implementing a year-long family-based nutrition and exercise program. D. Placing posters about healthy eating in local grocery stores. Answer. C. Implementing a year-long family-based nutrition and exercise program. Rationale. Behavior change requires ongoing support and engagement. A year-long program provides sustained education, resources, and opportunities for families to adopt and maintain healthier habits. The other options, A, B, and D, are less comprehensive and may not have the same lasting impact. Question 10. The community health nurse is collaborating with local schools to address teen substance abuse. Which intervention is most effective in preventing substance use among teenagers? A. Distributing anti-drug pamphlets during a one-time assembly. B. Conducting surprise locker searches for illicit substances. C. Implementing a comprehensive school-based substance abuse prevention curriculum. D. Inviting former substance abusers to share their stories with students. Answer. C. Implementing a comprehensive school-based substance abuse prevention curriculum. Rationale. A comprehensive prevention curriculum provides ongoing education, skill building, and support to help teenagers make informed decisions and resist substance abuse. The other options, A, B, and D, are limited in scope and may not have the same impact on long-term behavior change. Question 11. The community health nurse is assessing a neighborhood's risk factors for communicable diseases. Which of the following factors is considered a modifiable risk factor for the spread of infections? A. Socioeconomic status of the community. B. Geographic location of the neighborhood. C. Age distribution of the population. D. Hand hygiene practices of community members. Answer. D. Hand hygiene practices of community members. Rationale. Hand hygiene practices are a modifiable risk factor that can directly impact the spread of infections. Improving hand hygiene can help prevent the transmission of communicable diseases. The other options, A, B, and C, may influence the community's vulnerability to infections but are not as directly modifiable as individual behaviors. Question 12. The community health nurse is developing a disaster response plan for a community prone to hurricanes. Which action should the nurse prioritize to ensure the safety of vulnerable populations during a hurricane? A. Creating a designated evacuation center. B. Stockpiling non-perishable food supplies. C. Providing emergency medical training to community members. D. Establishing a communication network with neighboring communities. Answer. A. Creating a designated evacuation center. Rationale. Creating a designated evacuation center specifically for vulnerable populations, such as the elderly, disabled, and those without transportation, ensures their safety during a hurricane. This action addresses the unique needs of these populations during a disaster. While the other options, B, C, and D, are important, they may not adequately address the needs of vulnerable populations. Question 13. The community health nurse is conducting an assessment of a local community's environmental health. Which finding requires immediate intervention? A. High levels of air pollution from nearby factories. B. Elevated lead levels in the drinking water. C. Inadequate waste disposal facilities. D. Insufficient recreational spaces for children. Answer. B. Elevated lead levels in the drinking water. Rationale. Elevated lead levels in drinking water pose an immediate health risk, especially to children. Lead exposure can have serious and irreversible health effects. The other options, A, C, and D, are important concerns but may have a less immediate impact on health. Question 14. The community health nurse is planning a health promotion campaign to reduce smoking rates in a community. Which intervention is most effective for addressing both individual and population level change? A. Placing warning labels on cigarette packages. B. Hosting a one-time anti-smoking seminar. Answer. D. Implementing a comprehensive tobacco cessation program. Rationale. A comprehensive tobacco cessation program offers ongoing support, resources, counseling, and strategies to help individuals quit smoking. It addresses both individual behaviors and the broader community context. The other options, A, B, and C, are less comprehensive and may have limited impact on long-term behavior change. Question 15. The community health nurse is collaborating with local schools to address adolescent sexual health. Which approach is most effective for promoting safe sexual behaviors among teenagers? A. Distributing condoms and contraceptives in school bathrooms. B. Inviting a guest speaker to discuss the consequences of unprotected sex. C. Implementing a comprehensive sexual education curriculum. D. Holding a single workshop on abstinence-only education. Answer: C. Implementing a comprehensive sexual education curriculum. Rationale: a comprehensive sexual education curriculum provides accurate information, promotes responsible decision-making, and covers a range of sexual health topics. It empowers teenagers to make informed choices about their sexual health. The other options, A, B, and D, may not provide the same level of comprehensive education and support. Question 16. The community health nurse is working in a rural area with limited access to healthcare facilities. Which strategy would be most effective for improving healthcare access for residents in this community? A. Providing mobile clinics for preventive services. B. Distributing pamphlets about healthy lifestyle choices. C. Conducting occasional health fairs in nearby towns. D. Offering online health consultations through a website. Answer: A. Providing mobile clinics for preventive services. Rationale: mobile clinics offer direct and accessible healthcare services to residents in remote areas. They address both preventive and curative needs and can help bridge the gap in healthcare access. The other options, B, C, and D, may provide information or limited services, but mobile clinics provide direct care. Question 17. The community health nurse is developing a disaster plan for a community at risk of wildfires. Which intervention is essential to include in the plan to ensure the safety of residents with limited mobility? A. Distributing fire-resistant clothing to residents. B. Providing fire safety education to school children. C. Developing an emergency evacuation route. D. Offering mental health support to affected residents. Answer: C. Developing an emergency evacuation route. Rationale: an emergency evacuation route that considers the needs of residents with limited mobility is crucial for ensuring their safety during a wildfire. It allows for organized and timely evacuation. While the other options, A, B, and D, may have value, they do not directly address the unique needs of residents with limited mobility. Question 18. The community health nurse is conducting a needs assessment in a low-income neighborhood. Which finding indicates a potential health disparity within the community? A. High rates of volunteer participation in community activities. B. Limited access to fresh fruits and vegetables in local stores. Answer: B. Limited access to fresh fruits and vegetables in local stores. Rationale: limited access to fresh and nutritious food desserts, is an example of a health disparity, as it can contribute to poorer health outcomes among residents. The other options, A, C, and D, may provide insight into community dynamics but do not necessarily indicate health disparities. Question 19. The community health nurse is working with a group of adolescents to address substance abuse. Which approach is most effective for preventing substance use among this population? A. Distributing informative brochures about the risks of substance abuse. B. Inviting a former substance abuser to share their personal story. C. Implementing a school-based peer mentoring program. D. Conducting drug tests in schools to deter substance use. Answer: C. Implementing a school-based peer mentoring program. Rationale: a school-based peer mentoring program creates positive peer relationships and provides support for making healthy choices, which can be influential in preventing substance use among adolescents. The other options, A, B, and D, may have some impact, but peer mentoring directly involves adolescents in a positive, ongoing intervention. Question 20. The community health nurse is working with a culturally diverse community. Which action is essential for the nurse to take when planning culturally sensitive care? A. Implementing interventions based solely on evidence-based guidelines. B. Utilizing a standardized assessment tool for all community members. C. Seeking input and collaboration from community leaders and members. D. Providing educational materials only in the community's dominant language. Answer. C. Seeking input and collaboration from community leaders and members. Rationale. Cultural sensitivity involves understanding and respecting the beliefs, values, and practices of a diverse community. Seeking input and collaboration from community leaders and members ensures that care is tailored to the community's unique needs and preferences. The other options, A, B, and D, may not fully address the cultural context of care. Question 21. The community health nurse is working with a local homeless shelter to address healthcare needs. Which intervention is most effective in improving the health outcomes of homeless individuals? A. Providing occasional free health screenings at the shelter. B. Distributing brochures about nearby healthcare clinics. C. Organizing a one-time health education seminar for shelter residents. D. Establishing a permanent clinic at the homeless shelter. Answer. D. Establishing a permanent clinic at the homeless shelter. Rationale. Establishing a permanent clinic at the homeless shelter ensures ongoing access to healthcare services for homeless individuals. This intervention addresses the unique challenges and barriers faced by this population and provides comprehensive care. The other options, A, B, and C, offer limited or temporary solutions. Question 22. The community health nurse is involved in disaster preparedness planning. Which action is most important in ensuring an effective disaster response for a community? A. Developing a detailed list of emergency contact numbers. B. Creating a comprehensive emergency supply kit. C. Conducting regular disaster drills and simulations. D. Designating a central command center for coordination. Answer. C. Conducting regular disaster drills and simulations. Rationale. Conducting regular disaster drills and simulations helps ensure that community members and response teams are familiar with protocols and procedures during a disaster. Practice improves readiness and coordination. The other options, A, B, and D, are important but may not have the same impact on response effectiveness. Question 23. The community health nurse is addressing health disparities in a low-income neighborhood. Which action is essential for the nurse to take in order to promote health equity? A. Providing financial assistance to residents for healthcare services. B. Collaborating with local businesses to improve employment opportunities. C. Advocating for policy changes to improve access to affordable housing. D. Distributing free medication to residents with chronic illnesses. Answer. C. Advocating for policy changes to improve access to affordable housing. Rationale. Advocating for policy changes that address social determinants of health, such as access to affordable housing, is essential for promoting health equity. These changes address the root causes of disparities. While the other options, A, B, and D, may have short-term benefits, policy changes have a broader and more lasting impact. Question 24. The community health nurse is conducting a needs assessment for a local community. Which finding indicates a potential health issue related to environmental justice? A. High rates of exercise and physical activity among residents. B. Limited access to clean drinking water in certain neighborhoods. C. Availability of affordable fresh produce at local markets. D. Successful implementation of a smoking cessation program. Answer. B. Limited access to clean drinking water in certain neighborhoods. Rationale. Limited access to clean drinking water in certain neighborhoods is an example of environmental injustice, as it disproportionately affects specific communities. The other options, A, C, and D, do not directly relate to environmental justice concerns. Question 25. The community health nurse is working with a culturally diverse community. Which approach is most effective in providing culturally sensitive care? A. using a standardized care plan for all community members. B. Providing educational materials in the community's primary language. C. Implementing interventions based on the nurse's personal cultural background. D. Disregarding cultural practices that conflict with evidence-based guidelines. Answer. B. Providing educational materials in the community's primary language. Rationale. Providing educational materials in the community's primary language ensures that information is accessible and understandable, promoting culturally sensitive care. It acknowledges and respects the linguistic diversity within the community. The other options, A, C, and D, may not fully consider the cultural context of care.